Hello everyone. General anesthetics we will study in two parts. That is, in this class I'll be dealing mainly with inhalational anesthetics and minimum alveolar concentration, which is an important part of inhalational anesthetics. So to begin with, what is general anesthetics? So these are a group of drugs which will produce reversible loss of consciousness and sensation. They will also cause reversible loss of sensation and consciousness. So this is what is the definition for general anesthetics. And there are four cardinal features of general anesthetics. That is, anesthetics or a drug which is used as general anesthetic should produce reversible loss of all sensation including pain, as we already saw, and consciousness, that is the person should go into sleep, and he should also have loss of temporary memory, that is amnesia, and he should produce good, and that anesthesia should produce good immobility and muscle relaxation so that the procedure becomes easy, and it should abolish all the somatic and autonomic reflexes so that there should not be any involuntary movement. So these are the four cardinal features of general anesthesia. So this is the classification. So inhalational anesthesia is what we are dealing with today. So inhalational anesthesia, basically general anesthetics is classified as inhalational and intravenous. Okay. So in the inhalational we have gaseous form and volatile liquids which are given. Both are in the inhalational route, and which is a gas which is used as inhalational anesthetics is, that is, nitric oxide, and volatile liquids we have ether, which is not used nowadays, halothane, enflurane, isoflurane, desflurane, sevoflurane. These are the inhalational anesthetics. And intravenous we have inducible agents like thiopentone sodium, benzodiazepines, dissociative anesthetics like ketamine, and opioid analgesics, that is phentermine. This we will be studying in the further classes. So before we know what is these anesthetics, so you should know the stages of anesthesia, and this is the stages of loss of all the sensation and all that definition what you read about general anesthesia. It is classified as 4 stages. Okay, so and this staging is also called as Goodell's sign. Okay, and these 4 cardinal features are mainly seen when we give ether. Okay, all the 4 signs. Slow action, as much as it is more lipid soluble, the action is very slow. And there is always descending depression of CNS, and the vital centers which is present in the medulla will be getting paralyzed at the last. So moving on to various stages, I'll not go into too much detail. So there are 4 stages of general anesthesia. First is stage of analgesia, which will start from the time when they give you anesthesia till there will be loss of consciousness. Okay, here the person will go into dream-like state. Okay, and there will be the reflexes and respiration will be still normal. In the second stage, that is stage of delirium, which will start from loss of consciousness till the beginning of irregular respiration. Here we saw the respiration was normal. Here there will be loss of muscle tone will increase. Okay, there will be a state of apparent excitement here. Okay, BP, heart rate will raise to some extent. The third stage is stage of surgical anesthesia, which is used during this stage only we perform surgeries. Here there will be irregular respiration, and there will be cessation of spontaneous breathing, and this is further classified into 4 planes. Okay, plane 1, plane 2, plane 3, plane 4, based on the reflexes and eye movement. So stage 3, plane 2 is the stage where we perform surgical anesthesia. This is very important. Stage 3, that is surgical anesthesia, and plane 2 is where we perform our where there will be loss of corneal and laryngeal reflexes. This is when we perform general anesthesia. And the last one is the stage of medullary paralysis, where there will be loss of respiratory center and vasomotor center, and the person will die when there is too much anesthesia. So coming to the mechanism of action of various general anesthetics, so there is either of enhancement of inhibitory neurotransmitter or inhibition of excitatory neurotransmitters, like your NMDA. Okay, so there might be inhibition of excitatory neurotransmitters, or potentiation of action of inhibitory neurotransmitters, that is GABA and glycine. Those drugs which will enhance or potentiate the action of GABA is halothane, okay, propofol, etomidate is your IV general anesthetics, fluorinated anesthetics, that is N-fluorine, isoflurane, desflurane, sevoflurane, all these will potentiate the action of GABA, and also halothane, propofol, N-fluorane, these also will potentiate or increase the sensitivity of glycine receptors for these anesthetics, that is they will enhance the glycine mediated inhibitory action. And dissociative anesthetics, that is which is also an IV, so ketamine, even nitrous oxide and xenon also inhibit the NMDA receptors. So these are the various mechanisms how this general anesthetics will act. So moving on to individual inhalational anesthetics, to begin with the first one, that is ether, which is not commonly used now, because a good anesthetic should always it should be not inflammable, it should be pleasant sensation, okay, and it should not it should produce slow induction and slow recovery, okay, and it should produce good muscle tone. All these are there. So because it is an inflammable and volatile substance, we are not using this, and we also have better general anesthetics available nowadays. So diethyl ether, it is a highly volatile liquid, okay, it is a highly volatile liquid, and it is having pungent odor. Its boiling point is also very less, that is 35 degree, and it will produce irritating vapors, and it is inflammable and can also explode. For this reason it is not used nowadays. Pharmacokinetic property, it is all 80 to 90% it is eliminated through the lung, most of them inhalational, it is and the remaining things are excreted through the kidney, urine, milk and sweat, okay. It can also cross placenta, so not preferred in case of pregnancy and during labors. So advantage of this is it is compatible it is can be used easily without any good instruments, but it will produce a potent anesthetic and analgesic action. It also produces good muscle relaxation. It is having good safety margin, and it will stimulate respiratory centers and it will produce bronchodilation. It is also, all these are advantages. It also do not sensitize heart for adrenaline, or there is no arrhythmia, okay. It can be used in case of labor, and it produces less hepato and nephrotoxicity because it is not excreted through either of these organs. Disadvantage of this is, as it is highly inflammable, it can explode, okay. The induction is very slow, and it will also produce unpleasant sensation. The recovery is also slow, and it is usually associated with nausea and vomiting. It can also cause cardiac arrest and convulsion in case of children's, and this there is a cross tolerance in patients who are consuming alcohol. So these are the disadvantages of ether. So moving on to the most commonly used general anesthetics, that is nitrous oxide, so which is a colorless, odorless, inorganic gas which is sweet taste. It is non-inflammable and non-irritant, and but the potency is very low. This is very important point. The potency is very low, okay, of nitrous oxide. The potency is very low. That is the reason we usually use, but it is a very potent analgesic, okay, that is why this nitric oxide is usually used as a carrier or as an adjuvant with another other anesthetics. So 70% of this can be combined with 20 to 25% of anesthetics and 0.2 to 2%. So like this, oxygen 70%, 20 to 25% of nitrous oxide, and plus 0.2 to 2% of some other potent anesthetics can be used together to produce good anesthetic effect along with analgesic effect. As a single agent, it is used in case of tooth along with oxygen in tooth extraction and also in some obstetric procedures. So since it is non-inflammable, non-irritant, and it will produce rapid induction and early recovery with very good analgesic effect, it is a good anesthetic, and it also do not produce nausea and vomiting as ether, and it is not toxic to liver or kidney or brain. So these are the various advantages of nitrous oxide, but it cannot be used alone as a potent analgesic. That is one of the drawback. It can cause hypoxia, that is why it is always used along with oxygen. It will inhibit methionine synthase, okay, which is a precursor of DNA, and it will inhibit vitamin B12 metabolism. So it is the major disadvantage of nitrous oxide. And gas filled space can be, that is second, can happen, and that is why it might be dangerous. Moving on to the fluorinated general anesthetics, the first one is halothane, which is a fluorinated volatile liquid, which will produce sweet odor. It is a non-irritant, non-inflammable general anesthetics, and it is usually stored in amber colored bottle. It is a potent anesthetic, okay. It can be used for induction, that in 2 to 4% concentration, or for maintenance in 0.5 to 1% concentration. Pharmacokinetics, 60 to 80% is eliminated unchanged, okay, and 20% is retained in the body for 24 hours, and then it is metabolized. The boiling point is also very high, that is 50 degrees. So moving on to its advantage, so it is non-inflammable and non-irritant, as we know, and it produces pharyngeal and laryngeal reflexes. It will decrease, and it will produce bronchodilation. Okay, it is a potent. It will produce potent and speed induction and recovery, and it will produce controlled hypotension, okay, and there is inhibition of also intestinal and uterine contractions. So these are the advantages. Moving on to disadvantages, it is a poor analgesic and muscle relaxant, but a potent anesthetics. That is why usually we combine 2 or 3 anesthetics to produce good effect. So hypotension can be produced because of direct action on the calcium, and there can also be failure of sympathetic activity, okay. This is a major drawback, and it can also cause arrhythmia by direct vagal stimulation and depression of SA node, and can cause lack of baroreceptor action. It can also cause respiratory depression, okay. There can be decreased urine formation, and GFR can also be decreased, and hepatitis can occur in 1 in 10,000 people. So, and also one more important point, that is malignant hyperthermia in few patients because of stimulation of ryanodine receptor, and this effect is more when it is combined when halothane is given in patients with any psychiatric problems, and this can also prolong labor. So these are the various disadvantages of halothane, causing arrhythmia, hypotension. Okay, these are very important. Respiratory depression. Okay, it will also decrease the GFR, so it should not be given in case of hepatitis, liver failure, or any liver pathology, and also in psychiatric patients. So these all are things are to be very much remembered. Moving on to N-fluorine, which is also one of the non-inflammable fluorinated anesthetics. It is similar to halothane, except that it will also produce good muscle relaxation. So this also causes depression of myocardial force of contraction, and heart sensitizes heart for adrenaline. Okay, so this is one of the drawbacks, and very much important thing is it will induce seizures. Okay, when you give more anesthesia for deeper anesthesia, and that is why this should not be given in any EEG showing some epileptic changes. So in such patients, or any epileptic patients, or if EEG is showing any abnormalities, so N-fluorine is contraindicated. 1/10 of metabolism is 1/10 of that of halothane. It do not release any hepatotoxic metabolite. Okay, so it is renal the metabolism releases fluoride ion, which is renal toxic. So isoflurane is an isomer of N-fluorine. Okay, remember, isoflurane is an isomer of N-fluorine, have similar properties, but significantly it is more potent. For induction and maintenance, both we give. Induction, the percentage is 1 to 1.5 to 3%. Maintenance doses 1 to 2%. Okay, for maintenance. It isoflurane can also be given by special vaporizers. So advantages are more here. So it will produce rapid induction and recovery. It will produce good muscle relaxation. One important thing, coronary vasodilation is what is done by isoflurane. Very much important. This is the only general anesthetics which will produce coronary vasodilation, and also coronary steal phenomena, which is very commonly asked MCQ question. Please remember, coronary vasodilation is produced by isoflurane, and it does not have any effects on the myocardial as that of other anesthetics. Like they do not produce myocardial depression or sensitization to adrenaline. All that side effects is not there with this. There is no renal or hepatic toxicity with this drug, and nausea and vomiting is also not common. They do not dilate pupil, or there is no loss of light reflex in deep anesthesia. They do not produce any seizures or uterine muscle relaxation. So disadvantage of this is it might cause respiratory depression. Okay, and it can also stimulate beta adrenergic receptor, and this is a costlier drug. This is also one of the disadvantages. Sevoflurane. Sevoflurane is it is a pleasant smell, and it is a non-irritant and produce bronchodilation. Because of this reason, it is used for pediatric anesthesia. Very, very important, pediatric anesthesia. So this is commonly used, and it is also a second line drug in case of second line drug of choice in case of neuro anesthesia or cardiac anesthesia and asthma patients, because of all these advantages. And one more thing to be remembered with this is sevoflurane should never be combined with soda lime, because it will produce a compound A which is nephrotoxic. Okay, so it should never be. Other substances like triethylene and desflurane, they also produce similar effects with soda lime, so that is why they are not supposed to be used along with that substance. So last thing for today is about something called as MAC, or it is also called as minimum alveolar concentration. Okay, so MAC is a one of the important measure for seeing the potency of the inhalational anesthetics is mainly measured by MAC, very important. Okay, so what is MAC is, it is the concentration of inhaled anesthetics which is required to produce no response or immobility to surgical stimulus in 50% of the individuals. Okay, so that is minimum alveolar concentration of the inhalational anesthetics which is required to produce loss of movement in 50% of the individuals. It is different for different inhalational agent, and this can be increased in some specific conditions where there is hyperthermia, or if there is hypernatremia, or if there is some drug induced CNS catecholamine stores, like if you are giving some inhibitors like SSRIs or all those things, if the patient is on any drugs, and in case of chronic alcohol abuse, and also in case of increase in ambient pressure, any atmospheric changes. Two more important characteristics which we have to know in inhalational anesthetic is solubility in fat, which is nothing but oil gas partition coefficient, and solubility in the blood, that is liquid gas partition coefficient. So mainly this oil gas partition coefficient means some is the amount of gas that will be dissolved in oil base, which indirectly says the lipid solubility of the general anesthetic, and it is also one of the factor which will govern the potency of general anesthetics. Higher the solubility, more is the greater is the uh, general anesthetic activity or general anesthetic action. Okay, so every point is very important. So blood gas partition coefficient is the ratio or the concentration of general anesthetics in the gas phase in the blood. Okay, so lower the blood gas coefficient, faster is the induction and faster is the recovery. So these things they will ask directly, it is nothing but you have to just by heart and remember. So different uh, inhalational anesthetics and its blood gas and oil gas concentration is given. So they won't ask this numbers, but just go through. So here are few MCQs, two MCQs I have mentioned, so please go through. Thank you.